Back in your Health Watch tonight, a major change is under consideration for how Colorado will pay for and receive health care.
State lawmakers next month will receive a draft proposal for a public option, which they can then turn into law. We saw Andy KOEN in studio with a close look at the proposal that was released this week and how it will work. Andy.
Robin Elizabeth, since the passage of the Affordable Care Act, commonly known as Obamacare, the number of insurance companies selling plans on the Colorado exchange has dropped. In fact, several counties have only one provider. So the idea behind this public option is for state government to try and strike a balance between hospitals and insurance companies using price controls on both ends to give consumers a more affordable way to go to the doctor. Colorado's insurance commissioner believes the public option they've developed will lower monthly premiums.
What we're averaging of a 9 to 18% premium decrease for folks in the individual market starting January 1st, 2022.
The Affordable Care Act put federal price controls on insurance companies, but not hospitals. Consequently, health costs keep rising. This idea caps how much hospitals can charge at an amount roughly double the Medicare reimbursement rate.
What the hospitals would tell you, Andy, is that they lose about 30% on Medicare. So at twice as much as Medicare, if that's where we land, they should be able to have a substantial profit in that 200% of Medicare number.
The big insurance carriers would be required to sell these plans in rural areas where insurance options are limited, and they would also have to spend more of the money they bring in on premiums for patient care.
Very few states in the country have ever tried this. In fact, as far as we can tell, we're the second, and Washington State was the first, and that was just a few months ago.
The nonpartisan research group Colorado Health Institute conducts a survey every other year, and they say while more people are insured today, thanks in large part to the Medicaid expansion, health insurance keeps getting more expensive.
We asked people who didn't have insurance why they didn't have it. 90% of them said it was because it costs too much. And that's by far and away the highest that number has ever been since we've measured it in 2009.
There is a public comment period for this proposal. It ends on October the 25th. The report will then be finalized and submitted to the legislature in the middle of next month. If you'd like to weigh in, we've put ways for you to have your voice heard on our website, KOAA.com. Click on the news tab to find the public option story. Robin Elizabeth?